Everyone. My name is Rihanna Novelli, and I am the MSW intern at L&B Counseling. And today I wanted to share for this series a little bit about the difference between self-care and self-soothing, because there is a difference. And oftentimes when I'm meeting with clients, something that really comes up is not being able to distinguish what certain self-care versus self-soothing activities really are. And really what I see is self-care to me is more preventative. There are actions that are going to help, especially as part of a longer term effort or routine to help your mental health and to help you take care of yourself. Whereas self-soothing can be on the more corrective side. So self-care can be preventative and thinking about the longer term future, whereas self-soothing is a little bit more corrective and ultimately trying to fix some things that maybe have gone wrong or some burnout you're experiencing and trying to take fast action to be able to soothe yourself and to kind of help typically what we see in times that your nervous system is being overloaded. So I'm going to be talking a little bit about that today and helping differentiate between that. And we know that there are a lot of different areas of wellness. This could include physical health, financial health, emotional, psychological. I think I said emotional, but there are all different areas of wellness that is a part of our lives in some areas that we don't always consider. And even thinking about with relationships and vocational at your job, areas like that. And so these are things that we want to consider when we're thinking about our self-care and our self-soothing and in what areas are being activated, which areas of wellness and what constitute who we are really coming up for us in those moments. So one of the things with self-soothing, I mentioned it's more of a corrective practice, something that maybe you're feeling really down or all these things were building up at work and it led to you feeling just burnt out and not being able to take care of yourself. So some of these corrective activities, these self-soothing activities, are often helping when senses are becoming overloaded and you're getting really overwhelmed maybe and you're feeling it throughout your whole body and not really knowing what to do. One of the activities that we can do are box breathing. So I can model for that for you all here. So really what box breathing is, it's helping get more control and establishing that breath work and having your mind pay attention to what's coming up in your breathing, and especially in times when that can seem really difficult too. So doing this box breathing, we're going to be able to breathe in for 4 counts. We're going to hold it for 4 seconds and breathing out to a count of 4. And then there can be a 4-second pause before you're doing that again. And oftentimes with clients, we like to repeat that even in sessions for 3 to 5 times. And I found that that's something that they're able to do throughout their lives. This could be pulling into the driveway after a day at work, taking a bathroom break, when you find you have a second in the morning, even just waiting at a stoplight or when it's safe while you're driving at the end while you're paused. So this is something that is self-soothing in a way that you can check in with yourself and take care of yourself there. Another way to reduce the sensory overload that we see with self-soothing is the 5-4-3-2-1 grounding. So this is something where you are gonna, again, take that time when you have that space for yourself to point out 5 things that you see. What about 5 things that you feel? And really taking note of different fabrics or sensations and textures that you're feeling, like in my sweatshirt, in my sweater, and the blanket around me. Things that you're hearing. And sometimes there might be something really prominent that you're able to hear, but think beyond that. What else are you hearing? What little movements are you hearing? And then we're going to think of 2 things that you can smell and finishing with something that you can taste. And this is another way, again, when our senses are really in that overload space, getting really overwhelmed, of a way to get more grounded and planting your feet on the floor, if you're able to do that while you're doing this activity, is something that can really help as well to feel more in control of the situation around you. So when we're thinking about self-care activities, again, I mentioned this is something that is more preventative. These can be part of a longer term routine. And we talked about those different areas of wellness. This could be psychological, emotional, physical, vocational, within your relationships, financially. What are some of the questions that could be helpful when you're thinking about those areas of self-care? What is energizing about that area? What is energizing about your job? And on the flip, what is draining about that? What is getting in the way of you being able to tap into more of those energizing feelings? And maybe this could be something that's out of your control, but being able to tangibly identify what are some of these things that are interfering with me feeling more energized in a relationship, at work, in my physical health. And then this last part here is really thinking about what is something tangible. I like sometimes to think about this in terms of SMART goals. What is something specific, measurable, attainable, realistic, and within a time frame that you can do? What can you do more of that gets you closer to being able to experience those energizing sensations and feelings? And just some other ways that you can check in with yourself. I mentioned a couple different opportunities throughout your day of times that you might be able to find, 10, 15 seconds to yourself to be able to check in. Some questions to ask yourself are what are coming up for me in this moment? What where am I feeling this in my body? What emotion is present? Maybe there's something that is tying down and you're able to identify that. And where are you feeling that in your body? You're able to make those connections between some situations that are coming up for you. How can you take care of yourself in this moment? And thinking about where you are in the context of your day can be helpful too. What can I do in my situation and where I am now to be able to take care of myself as I'm checking in? Maybe that means it's time for a break. How long has it been since I've eaten something? Do I need a meal or a snack to hold me over until the next time I'm able to have a meal? These are just some questions that you can consider, and especially as throughout the day, as we're thinking, what is the difference between self-care and self-soothing? And these check-ins, these ability to turn inward and really understand what's coming up for you and how you're feeling at a given point in the day can also be a part of a longer term routine to help with that self-care elements. So next time that you're thinking to yourself and are engaging in some kind of activity, check in with yourself and think about what is really coming up for you. And is this something for self-soothing? Is this something for self-care? And how can I switch this to make it into something that is a longer part of my self-care routine? Thank you all.